Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 205 of the Ask Dr. Angela podcast. So, last week was crazy busy for me. And I typically, when I go into the office, it's all about face, body, and fashion. I like to dress to impress, but really it's for me because I like to just look good, and we love fashion in my house. But last week there was like a day or two when I just showed up in scrubs, and I was just tired. And a couple of patients said to me, "Oh my gosh, how are you? You look tired." And I said, because I am. How about because I am? I'm tired. It's like been a crazy week. I was on call over the weekend. And I just basically got my ass kicked. And so I had another patient say to me, "Oh my gosh, is it still like really exciting delivering babies?" And I said, yeah, it's still like super exciting delivering babies. And every delivery is equally as fun and exciting and amazing. However, the timing is sometimes really off, and that's the part that's not so fun and exciting and amazing, specifically when you're doing deliveries at, 2, 3, 4, 5 in the morning. And so, the last weekend that I was on call, I inherited 2 patients that were in labor. One woman came in and her water had broken. The other patient was being induced. I don't really recall why she was being induced. It may have just been an elective induction. But I mention that to say this. It was such a long process. And that's the thing about labor that most folks don't realize, is that sometimes it takes time. Labor is a process. You have to get into active labor, which typically occurs once you're about 6 centimeters or so. And basically means that that's the point where things really start kind of moving along. And lo and behold, once you progress to complete, which is 10 centimeters of dilation, it doesn't necessarily mean that the baby is going to just fall out. Now, certainly I have had some patients that are just like amazing pushers, and I've seen women push babies out in like 20 minutes or less. But I've also seen women take in excess of 3 hours to push babies out. And certainly from my perspective, when you're the physician and you have, family and all that stuff, certainly the lack of understanding or getting it is on both parts. You have folks on my side, they're like, "Oh my gosh, I can't believe you were gone the entire day. How does it take so long to deliver babies?" Because it just takes time. To patients that are increasingly inpatient and are wondering why it's taking so long for baby to just fall out. Well, by definition, labor means work. So that lets you know that it's not exactly easy. And so lo and behold, with these 2 patients that I mentioned previously, after a long day's work, both progressed to complete, and both ended up with C-sections because babies just decided that they weren't going to descend down into the pelvis. Now, when babies decide not to descend into the pelvis, it can be due to any number of factors. Perhaps it's a big baby, perhaps the pelvis is too small, perhaps baby isn't coming down straight away, i.e. baby's head is what we call asynclitic, or not coming down straight and just trying to move and turn. And these are babies that, end up with cone heads at the time of delivery. So I ended up sectioning these 2 ladies, and lo and behold, both had pretty significant cone heads. And so, I simply said to both of them, pre-delivery, you've been pushing for a long time. We're going to proceed to C-section, and they were both agreeable. And when we delivered the babies with the cone heads, we were reassured that we had, in fact, made the correct decision. So I guess the moral of me sharing this with you is just to say, be patient during the laboring process. There's no way to predict one way or the other. Labor is a process, and, we take things as they come. And the other thing is that if by chance you don't end up with the vaginal delivery, it doesn't make you any less of a woman. I know I see a lot of post-delivery guilt in patients that ended up with a C-section, specifically if you really wanted a vaginal delivery. Sometimes these things happen. So in closing, hopefully this will help you to realize, again, labor is a process and is, as previously stated, unpredictable at best. Thank you so much for tuning into today's podcast. It's always a joy, and I have so much fun doing this. If you happen to have a question or a topic that you would like featured on the Ask Dr. Angela podcast, go to www.askdrangela.com. That's AskDrangela.com. You can send me a direct email, or you can direct message me on any of the social media venues. While visiting our amazing website, please sign up for the podcast, sign up for our YouTube channel, and sign up for our informative yet hilarious weekly blog post. We're doing so many amazing things over here at Team Ask Dr. Angela, and would love for you to be a part of it. In closing, I'm going to leave you with this. Some people succeed because they are destined to, but most people succeed because they are determined to. That comes from the Congratulations Graduate book, and it's one of my favorite books of inspiring quotes, poems, and stories. Until next time, look better, feel better, be better. Can't wait to reconnect on episode 206 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.